Hello, veterinary friends. Welcome to the podcast. Today, I have a wonderful guest for you. His name is Dr. Cliff Redford, also known as the Worldwide Vet. He's a veterinarian, hospital owner, podcaster, YouTuber, and world traveler. He spends his time when he's not in the clinic rescuing animals all across the globe. He's also a regular guest expert on Canada's #1 daytime talk show, The Morning Show. And I'm looking forward to hearing some of his rescue stories today and about his career. Welcome to the podcast, Cliff. I'm delighted to have you here.
Thank you so much for having me. It's going to be fun.
Yeah, it's nice to meet you. And I briefly read about your career, but I'm looking forward to you telling me in your own words your veterinary story. That's where I always start.
Yeah, that's a great start at the beginning, right? That's a good a good spot to do it.
Yeah.
I graduated from OVC in 1998. I was just a young 24-year-old, very wet behind the ears, like all of us were, and didn't think I knew a lot, and quickly realized, I think when we graduate, especially from Guelph and some of the high level schools, we know a lot more than we think we do. And I ended up buying a struggling one person practice just a year and a half later. I think I quickly realized I do better when I'm working for myself and not someone else. My ex-wife might say I have a problem with authority. I don't know if that's true. She's still true about most things, so we
Yeah, I
can
think a
joke
lot
about
of
it.
us a lot of us are kind of bossy and independent, so ownership kind of
Yeah,
scratches that itch.
yeah, independent, definitely. I mean, yeah, maybe bossy. Who knows? Who
That's
knows?
my word. You don't have to accept that word.
That's fair. That's fair. I don't mind. And so I ended up, I was happy owning a companion animal hospital just outside of Toronto and raising our three kids, my wife and I. And my kids will joke it's a midlife crisis. It was a midlife crisis, and maybe it's partially true, but 9 years ago, I stumbled upon the world of traveling and volunteering. And I did a 3 week trip in Jamaica, and it was mostly to volunteer, but I was also going with a small film crew, some new graduates from a local film school. I paid them in beer, pizza, and a trip to Jamaica, and they were happy to take it.
Sounds
And
good.
we filmed my adventures. My son and I. My son came with me. He was about heading to university, so it was kind of a good way of saying goodbye. And I fell in love with the traveling and the volunteering, and ended up that sort of became my second wind. Although I love and I always loved being a veterinarian, and I wasn't burning out, I wasn't getting tired of it. This was just an opportunity for me to have a new adventure, and it ended up forcing me to learn about wildlife medicine again. When I was in Jamaica, I did some work with some small bats. I was asked to do an eye removal surgery on an American crocodile named Jack.
Oh,
Yeah,
that's
and
awesome.
I was like, I don't know how to do this. They handled the anesthetic and the wrestling of the crocodile, and the joke is they basically said, just pretend it's a dog with really, really dry skin. And they're right. Now, mind you, it's a lot easier removing things than putting things back together, I've found.
Sure. Yeah,
Um,
absolutely.
yeah, so I continued to travel and have been as far as India, as far as the east, and then north. I've been up to the Arctic Circle in January twice. I'm the only crazy enough vet, I think, to go up there when it's minus 40 degrees all the time.
Yeah.
Um, and, been to some war zones and done spay neuter clinics in the middle of the jungle, and started volunteering once a week, and I still do this at Shades of Hope Wildlife Rehab. Every Thursday. It was only supposed to be for 6 months when I started 7 years ago, to work on my wildlife skills, and I fell in love with the wildlife medicine and the volunteer work. So that's sort of been the next chapter in my career. And while I still run my practice and work there 5 days a week with one day a week at the wildlife place, that's sort of how I've reinvented myself and expanded my love for this career, for this profession.
What's the biggest difference do you see with the work you're doing in the clinic and the work you're doing with the wildlife as far as like what surprised you? What was the thing that you were like, why is it's so much fun? Or what did you see as a difference?
Yeah, I mean, I think the fun aspect was twofold. It was one, the challenge. I was and still am a very good soft tissue surgeon, but I didn't do orthopedics other than I used to do cruciate repairs, extracapsulars, but no TPLOs or TTAs or anything like that. And when I got there, and I was the only veterinarian volunteering there, so everything was up to me. And they said, you're going to have to learn how to do broken bird wings, pinning broken bird wings, because you're our only
Your
hope.
only hope.
That's right.
It's fun.
There you
Yeah.
go. I was the Obi-Wan to their Princess Leia, maybe.
Yeah.
And you know, I looked at old X-rays and I watched YouTube videos and I opened up a book and it went back. I went back to school in my own mind, right? And I quickly realized, oh, the foundations of lessons that I received at Guelph were pretty solid. And I started to remember about how the pin can't be too close to the joint, and you got to have stabilization on either side of the fracture, and all these different sort of factors. And did some surgeries on cadavers. So if we had a hawk come in that we couldn't save, be it a medical or surgical issue after we euthanized it, I would take a hammer to one of its bones and give it a little break and take an X-ray and pretend that I was doing surgery on a live animal. Um, and it got to the point where within 6 months I was repairing and then releasing bald eagles and red-tailed hawks and great horned owls. And then, my repertoire expanded to mammal orthopedics, and I did surgery on an American bullfrog with a broken tib fib. All these different things. So it was fun. The challenge was fun. I was learning some new skills, made me a much better veterinarian, of course. And then the other part, it was so fun because of these creatures. Like, they are so beautiful. And when I was a child, I didn't decide to be a veterinarian. I didn't make the commitment until final year of high school. Although it was always on the list of possibilities, I really wanted to be a wildlife conservationist or a zoologist or a marine biologist. And so I was always fascinated with wildlife. And this brought out the child in me, and still does. I go once a week. I'll be going there tomorrow. And I walk in there without knowing what I'm going to see. I'm now skilled enough that I just walk in and there's a treatment list. And look, I can't do anything without the technicians and the rescuers that are there. And they still teach me. I'm still commonly saying, I need to give this animal an antibiotic. Which antibiotic can I give? Because porcupines can't have penicillin, things like that.
Right.
So I guess that's the third thing, is it really strengthened my ability to work with others and to keep my mouth shut and my ears open and ask a lot of questions of the non-veterinarians. They're brilliant what they do there, and I absolutely love it. And this is my future. Like, I'm only 52. I'm not interested in selling my clinic. I'm not interested in retiring anytime soon. But when I do start to cut back significantly in my hours, hopefully, not for another 10 or 15 years, I'm going to start volunteering more and traveling more and dealing with, you know, now wildlife from other countries, and being able to, and surf a little bit. That's a real big deal for me. I want to be able to start surfing in water other than Lake Ontario in November. Um, so that's it's nice knowing my future and seeing that, instead of a retirement plan, but a plan after work is probably a better way of putting it.
I love that way. That I love putting it that way because I think being one of those people that is at retirement age, I don't really like that word. I want to keep being useful and keep pushing forward and making this profession great. So I love that.
Yeah, I think a mistake. people do in any profession is they think of retirement as, well, I'm not going to work anymore. Well, then what are you going to do?
Right.
Like it doesn't mean you should be working forever. Absolutely not.
Yeah.
But, so many people, they focus on their financial retirement plan, very important. But what about your life? What are you going to do? You can only travel so much. So you got to have some sort of hobby or a new skill you're going to learn or some sort of group that you're a part of that's going to, take up a lot of your time and give you a reason to get up out of bed.
Yeah. And I think that if we keep that in mind, even currently, wherever you are in your career, that this is, you're not going to work as a slog or a drag. It's a passion. That's something that's exciting and challenging. And so I love the way you put that as it was a new challenge for me.
Yeah, yeah, I really, really enjoyed it. And like I said, it was only supposed to be 6 months with the wildlife rescue, just to kind of work on some of my skills, and especially avian medicine and surgery. And I'm still there. 7 years later, I'm still there, and I'm still learning, and obviously a lot better than I was. It's given me an opportunity to talk to people like you and share my experience with students. I do a lot of talks with the Zoo Club and the Global Vets Club and all those sorts of groups. It's really, I don't know, it kind of makes me feel younger, which is nice.
Yeah, I love that. So, how do you start with something like this? I talk to a lot of people that are in that part of their life where they think they want another challenge.
Mm.
They've been in medicine for 10 years or whatever, and they're feeling a little stale, but they have this huge imposter syndrome that they can't do anything different. How did you make that mental transition to, I'm a small animal veterinarian, I run this clinic, and now I want to be a wildlife conservation rescue veterinarian and actually get over yourself, get over the imposter syndrome to just go for it. How did that happen?
Yeah, this might sound a little bit egotistical. I don't mean it to. I've never experienced imposter syndrome. Like I know there's a lot of things I can't do.
Sure.
And I remember especially being that new time clinic owner, only a year and a half out of school, 26, 27 years old. I remember referring cases that now I wouldn't refer because I
Sure.
knew where my skill set was. But I've always, sort of jumped to the challenge if it was needed, and if there was no one else available. And this was even before being a veterinarian, taking up a sport that I really have no business in do. I mean, I played a bit of football when I was a kid, and I'm 5'7", if that, and at the time 150 pounds. And I just wanted to learn a new skill. There was a time where I was learning how to speak Mandarin and got very good at it. Now I'm learning to speak Greek. My wife is Greek, and we plan to kind of semi-retire there eventually. So if I can handle learning how to speak probably the most difficult language in the world, imposter syndrome is not an issue. I think, first of all, people need to be confident, especially veterinarians. Like we are so skilled. Our foundation of learning is so solid that as long as we can rely on some other people, and for me, it was relying again on the non-veterinarians, and not only at Shades of Hope here in Ontario, but on all these trips. My first trip to Jamaica, on day two, I was doing my very first sort of real surgery was a Pio spay on a 100-pound Akita that was 7 years old that had Ehrlichia, so it was a bleeder dog. Our
Wow.
anesthetic was old, like we were using injectable anesthetics only, xylazine for crying out loud in dogs, which, I had done a paper in 93 about why we don't use xylazine in dogs, but that's all they had, right? And
Right.
then I went in there and the uterus had ruptured and
Wow.
they didn't have enough gauze. Like there are so many challenges due to finances and whatnot. But Mr. Henry, the technician that was working with me, who was a local, born and raised in Jamaica, and had been working for the SPCA since he was 17, and he was in his 50s, so he had some experience.
Yeah.
he was literally, I didn't ask him. He was offering his advice or telling me what to do, but he was right. So maybe I'm okay with authority because I was listening to him. But
Right,
he was
right.
like, cut here and tie here, and then your suture's too long. We can't afford that. Shorten your suture. He was right every single time. And the patient did great, and it was probably the hardest surgery of my career at the time for all these different reasons. So if people are feeling incapable and they want to make those changes or they want to challenge themselves, they got to realize they're not alone. They can reach out to others. It doesn't have to be a veterinarian. It can be in my case, a wildlife rescuer or a wildlife technician or someone like Mr. Henry. And then do your research, do your studying, go back to school in your head, and sort of get ready for some complications. And you'll be surprised at what you're able to do. And then the other thing is don't jump into it. I jumped into it, but that's sort of my personality. I went from, no volunteering to 3 weeks solid in Jamaica. 15-hour days, 21 days straight. But I was there to also film, and I was trying to get this TV show thing going. So I had a lot of passion. You don't have to do that. If you're looking to volunteer, when you're going on vacation somewhere, I bet you there's an animal rescue that would love to have you volunteer for 2 half days, and you don't even have to do anything extreme. You can just do exams, offer some advice, do some vaccines. I bet you that animal rescue owner will invite you to their favorite restaurant. You can get out of the all-inclusive resort and go see some real culture, and make friends. And if you like it, then you expand from there. So just give it a shot. Just ready, fire, aim is what I believe in. Although I don't like guns, but for
Yeah,
anything else, just go for it. You'll figure it out.
right. You'll figure it out. And then give your best advice to someone that is fearful of that, of the mistakes, because we have such a perfectionistic culture in vet med right now. And there's a big fear of making an error or losing an animal, or, how do you deal with that? Because you're going to do more of it in wildlife.
Yeah, and the with me going up to Shades of Hope, they see about 11,000 animals a year. I don't see anywhere near that many, obviously. Now, most of them they don't need my help. They're
Right,
like eyes closed squirrels that need feeding or something
right,
like that, baby bunnies that need care. So the ones that I see, probably 20% of them never make it out of there. And either I choose or we choose to euthanize, or we try and save them and it doesn't work. They die
doesn't
under
go well.
anesthetic
Right.
or they can't handle the recovery. So a week later we have to say goodbye. With me, it was easy because they literally handed me, after about 3 weeks of volunteering there, and their other vet who was volunteering was leaving. So then the first week I'm on my own, they handed me this red-tailed hawk and said, it's got a broken humerus. I hope you're ready. And I said, oh, I'm not. Like I've done the training or I've done the
Right.
studying, but I'm not, I just still don't think I'm ready. And they said, well, we're going to euthanize. So might as well
You don't
try.
have a choice.
Yeah, so we
Yeah.
don't have a choice.
Right.
Now, that patient passed away under anesthetic before I was able to start the surgery. So I did the surgery anyways, and x-rayed
Right.
it, and it looked good, right? So it
Yeah.
was an anesthetic issue. So if you're really, really worried, I mean, this might be a little extreme. Put yourself in a situation where you're the only hope. And that's how our predecessors did it. When I graduated, I worked for this guy, Dr. Gil Plummer, in Nobleton, Ontario, for about 9 months, and one of the greatest mentor anyone could ever ask for. Well, he was of the generation where there was no referrals, there were no
Yep.
traveling orthopedic surgeons,
Nope.
and he was doing advanced orthopedics because he was forced to when he was younger. So for the people that if they truly feel imposter syndrome or they're not up to it, then they shouldn't proceed. If they really don't think they can do it, then they shouldn't. But then figure out where your deficiencies are and work on them. I'm a marathon runner. I didn't go and run a marathon to begin with. It took me
Sure.
5 years before I qualified for
And lots
Boston.
of failing, right?
Yeah, yeah, lots of failing, and I compete in martial arts tournaments, and I was doing really well as a judo fighter until I got my brown belt, and now I have to fight black belts, and I went 0 for 17. I lost 17 straight, and I ended up figuring it out, and then I became, a sort of a provincial champion at that stage
Yeah.
once I so baby steps and find a mentor. The mentor doesn't have to be a veterinarian, and maybe put yourself in a situation that you are a little uncomfortable, and recognize that you're gonna manage it. You're gonna come out stronger and better.
Yeah, because from that uncomfortable feeling comes growth.
Absolutely, yeah.
Right?
With
You're not going
anything,
to grow unless you do feel a little bit awkward.
yeah, yeah,
And
exactly.
yeah.
Yeah. Yeah, and you have to get comfortable at getting uncomfortable. Like you almost have to I relish it. I look forward to it. Not at the exact moment, but beforehand and afterwards. I feel really good.
When I'm in the middle of the pile that just ruptured, it doesn't feel so
Uh,
good.
that was not fun. That was not the funniest thing about that was like, it had ruptured and I couldn't see anything because of all the fluid. And I was like, I need more gauze because I only had literally 4 squares of gauze.
Wow.
Um, and he said, well, that's all we have. Like they were so budget constrained. He's
Right.
like, that's all we had. I looked around and there was a pile of towels. And I was like, give me one of those towels. And he said, but Dr. Cliff, those aren't clean. And I said, well, no, he said, those aren't sterile. And I said, well, neither is this,
Neither is
pointing
the
at the
pus
thing.
in the abdomen, right?
That's right. It's like, I can likely fix an infection. I
Right.
can't fix it if the animal dies.
Right. Exactly.
So I
Yeah.
shoved the towel inside, absorbed everything, got her on antibiotics afterwards, and she did great. So
Yeah.
yeah, I was very uncomfortable, and I came out a much better veterinarian.
So if somebody's interested in getting started, maybe doing some of the traveling and the things that you do, how did you practically start that first trip that you took? How did that come about? How did you make that happen?
Yeah, so again, it was as much for this TV show dream as anything. So the original plan, as I had mentioned, I was learning Mandarin. The original plan was I was going to go to Beijing. I had a friend through social media that ran an animal rescue in Beijing, and it's like, hey, come here for a month. It'd be a great way to practice your Mandarin. And then there was something about Westerners coming to China with cameras filming animal welfare that they decided probably wasn't a good
Wasn't
idea.
a good idea, yeah.
Wasn't a good idea. So Jamaica was my sort of my backup plan, and I just started reaching out. And the great thing about being a veterinarian is we do have a skill that is in high demand everywhere. Everywhere has animals,
Right.
even if it's just cats and dogs. Everywhere has animals. So I reached out to the JSPCA. I reached out to the Jamaican Vet Medical Association and got my temporary license. And then I went because it was such a big trip for me. It was a 3-week trip that I was financing myself, and again, this small film crew, and it was so grand. It was way larger than it needed to be if it was just a volunteer situation. I went down for 3 days a couple of months prior to meet the people I was going to be working with, to find out about stories, that sort of thing. So I did my due diligence. But now, like, people know around the world that I like to travel and I like to volunteer. And if any other veterinarian listening wants to do this, they can just get the word out through social media that they're interested in volunteering, and rescues will approach you and say, hey, we would love to have you come. Now you got to decide how many days do you want to do, what kind of procedures do you want to do. If you only want to do vaccines and health checkups, great, that's easy. You can even bring those vaccines with you. But if you want to do surgery like I do, make sure they have the infrastructure. You got to have you can't get all the drugs. I sometimes bring medications with me, but not the majority of them. I use what they have there. And you're going to want to see, well, is there a veterinarian I can work with? And often it's a veterinarian that needs a mentor and is excited to learn from a vet from North America, let's say. But then you'll find that you're going to learn from that veterinarian as well. So that's if I had to do it again. And well, let me talk about my daughter. So my daughter's not a veterinarian. She's not a formally trained technician, but she's traveled on a lot of these trips with me and has become my sort of technician, so to speak. Well, she ended up 3.5 years ago doing, she was 20 at the time, doing a solo backpacking trip through Europe for about 6 weeks, but also volunteering at animal rescue groups on a small island in Greece, up in Spain, a bit of time in Italy. And she just reached out to rescue groups, asked people, kind of got references, sort of informal references, and was able to then spend a couple of days at each place in between vacationing. That's an easy thing that a veterinarian could do. And then there's great organizations like International Volunteer Vet Organization, I think it's called IVVO, where they
Hmm.
have a volunteer program in Costa Rica as well as Australia. They're working with a group called SOSA, Save Our Species Alliance. Blake Moynes he was a guy from The Bachelor or Bachelorette. Is a very handsome guy that was an animal rescuer, and he didn't get the final rose, but he has now used his fame to create this wonderful charity. Um, so there are organizations out there too that you can travel with. If anyone wants to reach out to me, a friend of mine's ex-wife, now she's more my friend than he is. Um, she works on one of those TV shopping channels,
Yes.
the
Yeah.
television shopping channel,
Like shopping networks. Yeah.
shopping network, and
Yeah.
she's very popular. She's very successful with it. She is, I think, right now in somewhere Roatan, maybe in South America, and not a veterinarian at all, obviously. She has 20 veterinarians and technicians joining her for now this like fourth spay neuter clinic where they're going to end up doing over the course of a week a lot of vacationing, but
Right.
also several hundred spay neuter programs. And it's literally, as a veterinarian, if you just fly yourself there, you pay for the flight there and the flight back, and the food. They've got a
Yeah.
place for you to stay. They've got the organization. They've got the permits, the drugs, everything. So there's ways of doing this that's very,
Yeah.
very easy. You don't have to do it the way I do it.
And you don't have to get like a special license or anything like that if you have a license in the United States.
No, it depends. So, like, when I went to Jamaica, I had to apply for it. It's very easy, but I had to apply for a temporary license. And they
Okay.
basically they it's a little bit gives money so that they can do some of their
Sure.
licensing stuff in Jamaica, but they
Right.
check that my license is legit. They make sure there's no finalized complaints, that sort
Right.
of thing. Even if you have a complaint with, CVO in my case, in my province, it's not a big deal. And then when I went to Egypt, they didn't care. When I went to India, they didn't care. When I went to Panama, I had to work with a Panamanian veterinarian. And that's great. They sort of
Right.
organize stuff, and I help finance it. So it depends on where you're going and what you're
Yeah.
going to be doing.
You have to do your homework.
Yeah, but it's not hard to figure that out.
It's something you really want to do.
Yeah.
So tell me some of your favorite stories of things that happened or interesting scenarios you were in or
Yeah,
good,
there's been
good
so
or
many.
bad.
Definitely one of my favorites was I went and volunteered during the current Ukraine-Russian war twice.
Scary.
And the first one was 3 weeks into it. It was a spur of the moment thing. And other than a day into Lviv, I worked at the border, the Polish-Ukraine border. Now my daughter joined me. It was actually she was on that volunteer backpacking trip, and I texted her and say, "Hey, just let you know your dad's
Going to
decided
Ukraine.
he's going to Ukraine." And she was
You
like,
want to
"I'm in
come
Spain.
visit
Get
me?
me a yeah." She's like, "I'm in Spain. Get me a ticket. I'll come and join you. Don't tell mom."
Yeah, right. Don't
We're
tell mom
we're
for sure.
yeah, we were divorced by then, so my ex-wife would not have been that happy, understandably.
Sure.
So, but the amazing story was I was working with this Australian veterinarian, Dr. Lachlan, who, like me, was just a get up off the couch kind of guy. He just had shown up. And it was a quiet day. We're in the Poland countryside, and we decided to go for a hike. And all these things failed. Like we couldn't find each other, and then we got lost, and then the place was closed, and all these different things. And we ended up just let's just find a field. We're just gonna walk. We're just gonna make a trail kind of thing. We ended up stumbling upon a deer with its head, with its antlers wrapped around this rope, sort of fence line, this rope line that we later realized hunters had probably set up to capture the deer so then they didn't have to go and find them.
Right.
Because at the end of the field was one of those hunting towers. But like he was like, I don't think there are deer here. And I was like, there's one right there. Like, oh my gosh, what are the odds? So he, of course, he sort of slaps me on the shoulder and he's like, let's go be heroes, mate. And that's how he talks. And I was like, okay, wait a minute. Now he's a little younger than me. I was like, wait a minute, let's figure out how we're gonna do this because this is a big animal and it's scared and it's
Yeah, we
bucking
don't want
around.
to get hurt.
That's right. And he says, well, easy, we're just gonna go tackle it. And literally he goes off. Like it's like there ends our strategy session. I
He
thought
was
I was a crazy man.
like the crocodile hunter. He was just going to jump on it and take it
A
down.
100%. And the video is on my YouTube channel. So I'll send it to you. You gotta watch it.
I
And
love
that's
it.
exactly what happened is I grabbed the rope and started to pull the rope closer, and the deer's sort of spinning around, and I'm jumping over the rope as it goes under my feet. And he just leaps and grabs onto the base of the antlers. It first slams him to the ground. He doesn't let go.
Wow.
Um, he stands back up as the deer and Lachlan come towards me. Probably 400 pounds, 500 pounds now of weight. I guess my judo training took into account. Judo's all takedowns and flips, right?
Yeah.
Because I saw this like instantly, this opportunity, and I literally just dropped my shoulder and kind of hit the deer at a certain spot, and the deer went down. We quickly used our grappling skills to hold it down. I covered its eyes so it would calm down. And eventually, it took us like 20 minutes to get this rope off.
Wow.
And so have you. And then this thing, took off, didn't say thank you.
Of
Almost
course
got
not.
caught in another rope line,
On the
a
way
100
out.
yards down the way.
No.
But that was one of my favorite stories. One, because it was kind of dumb. Like we could have gotten hurt and the deer could have gotten hurt,
Right.
looking back at it now. But these animals seem to find me on these trips, these injured animals. Either that or like the fates are like directing us, towards it because
Yeah.
all these things had to happen for us to see this deer right at that moment. There were
Right.
literally vultures flying overhead, waiting for this deer or
And
one
if
of
you didn't go
us.
on this impromptu hike, you would have never seen it.
Yeah, exactly. And in
Yeah.
that particular location, like we were not planning on doing that. So that's definitely one of my favorite memories. A quick story is one of my other favorite memories is when I was asked to go down to Panama to do a spay neuter clinic. I did multiple, but one of the trips was to the island community of Bocas del Toro. And Raul, who ran the turtle conservation group, had called me down and I butcher his accent, but I love it, so I'm going to try it. He would say, Dr. Cleef, the dogs are killing my turtles. And so the street dogs were digging up and eating his turtle eggs. So
Aw.
here was my chance to help this very successful and needed turtle rehab program by spaying and neutering the local dogs so that they wouldn't then eat the turtles. And we're doing this spay and neuter clinic with no electricity. We're in this like steel covered these steel vertical poles and just a old steel roof out in the middle of the jungle, and the howler monkeys are screaming at us and howling at us and occasionally throwing things in our direction while we're doing these surgeries. Much easier than the spay that went almost terribly wrong in Jamaica. We didn't have complications like that, but like what an amazing experience to be able to do this in God's country down south. So That's just two simple ones. There are every single trip I do, almost every single day on these trips. I go to bed going, I can't believe I just did that.
Yeah. Well, and I think the one of the lessons that I'm hearing you say by going through all this is that, a lot of us in vet med try to think that it always has to be perfect or everything has to be done perfectly. The surgeries have to be, 100% sterile. And we have this kind of pounded into our head in school about how well we have to do everything in order to make it work. And in
Hmm.
these cases, you don't have that option and it still works.
Yeah,
And
it does.
that's kind of a lesson that it doesn't always have to be perfect.
Yeah, it does still work. I mean, in Panama, we were following their protocols, and their standards are a lot higher in their vet hospitals, but
Sure.
it's even high level. Like I worked with Dr. Jonathan, a veterinarian from Panama, a week before I was in Bocas del Toro when we went to this tiny little community about 3 hours away. They hadn't had a vet. There wasn't a vet for hundreds of kilometers. They hadn't had a vet there for 3 years. So it was a spay neuter vaccine and deworming clinic. And, so although we cut corners, this was something that a very high level, well respected veterinarian, Dr. Jonathan, did every 6 months. And, so the standards were still good. They would not they would not be appropriate in a hospital, but they were still excellent. And no blood work, obviously, and IV placement, but rarely IV fluids. Obviously, no anesthetic monitoring equipment, but what we did have were high level technicians and veterinarian students monitoring the anesthetic. And
Right.
they're very, very good. How often do we get a signal of hypotension on a blood pressure machine and we know it's not, the animal's not hypotensive? So we
Right.
don't trust the machine. We say, check it, have a
Right.
technician check it. Well,
Yeah.
guess what? Technicians are brilliant. So, yeah, you can cut corners without sort of doing bad medicine or bad surgery, and then you make do. These animals, most of these animals were bleeder animals due to Ehrlichia, due to anaplasmosis, things of that disease, all these tick-borne diseases. So they would give shots of a drug called quercetal, which I didn't know existed, and to them is part of their premix program on during these spay neuter programs. And quercetal basically stimulates platelet aggregation. It stimulates blood clotting. So they find ways around it, and this is why it makes me a better veterinarian. Because then when I come back and I've got my stainless steel table and my fancy lights and my anesthetic monitoring equipment and my registered vet technicians and all the drugs that I'm used to, well, that pyometra surgery is super easy because I don't have to ask for a towel to shove into its abdomen, right?
From the
I might
floor.
actually get in there before it ruptures,
Right.
like
Exactly. Yeah.
so yeah, it doesn't have to be perfect. And I think it goes back to being comfortable with being uncomfortable. We have to recognize, well, do we want it to be perfect, or do we want to save the animal or make a difference in animal welfare and wildlife conservation? If it's the first one, then these trips aren't for you. But if
Right.
you really want to make a difference, then you need to be able to be flexible a little bit.
Yeah, and I think the real lesson is that what we do is very important and does make a difference.
It
And
does.
we need to embrace that and be proud of that.
Yeah, yeah. I find these trips incredibly impactful for me. Although I'm volunteering, I get so much out of it. So I actually feel blessed to be able to work with these people. They feel very lucky to have me. I don't think they need to feel that way. And I'm able to make a difference, which makes me feel good.
Well, I appreciate that. It sounds really fun. Is there something that I haven't asked you that I probably should?
I don't know. That's a tough one. Um, these trips are amazing, and again, the big focus on this is get out there and make a difference and be uncomfortable, et cetera, et cetera. We were talking a little bit in the beginning about burnout and compassion fatigue. I was interviewing on my podcast an American veterinarian that sort of specializes or has an interest in what he calls clinical empathy.
Yes.
So having empathy for the clients and for the situation. And he had this great saying that he stole from someone else. Now I'm going to steal from him,
Good.
that fulfillment is a great shield against compassion fatigue and burnout.
I
And I
love
had
that.
never thought of it that way. Like I'd never realized, why do I not I feel physically burned out sometimes, but it's usually because I'm boxing at 5 o'clock in the morning and sparring, and then I go to work. So I
Right.
get punched a little bit, but when we talk about burnout, we're talking about emotional burnout, and professional burnout. I think if we truly embrace how blessed we are to be in this profession and find ways that fulfill us and have that positive impact on whatever is important to you, what a great remedy, or not even remedy, a preventative against compassion fatigue and burnout. It's that whole, if you love what you do, you won't work a day in your life. I'm not doing what I'm going to do. I'm not doing what I do for free. I mean, other than once a week.
Right.
I got to get paid, but boy, do I love what I'm doing, and it's super exciting, and I feel fulfilled. So I hope, and I love that you're doing this in your podcast. I hope our industry understands that more and more, that there are ways other than reducing your hours and just constantly looking for a better situation. There are ways to avoid hating your job, and it's by finding something that truly fulfills you and grabbing it by the horns like we did with that deer, and work to set it free, and then you have this positive impact and you get this great story out of it. So
And all the good feelings, right? When it runs free and it would have died otherwise.
it was so exciting. It was so exciting.
Oh, that's so cool.
It was so amazing, and I think it was a female, as she jumped up, she kicked me and knocked my phone out of my hand. But we had this GoPro set up, and then she goes running down the field, and there's another rope line, and she ducks under, and we're like, oh no!
You're
But
like,
she
here we
ended
go
up.
again.
She made it. Here we go again. This time we would sit back and think about it. Yeah, I mean these stories. They go on, and it just keeps me loving my profession, and still loving like the cats and the dogs.
Sure.
If
Well,
most
because
vets
they're the
are,
same, right? They're
they
they're
are,
just
and
wild creatures that we brought into our homes.
yeah, and the other nice thing, as far as volunteering and going out to these kind of developing countries or these war zones. I don't really recommend that for everybody.
Yeah.
It got pretty dangerous the second trip I went to Ukraine. I went on my own. Um, when a client complains, it's like water off a duck's back now.
Right. Yeah.
I don't have a fancy car, and obviously I'm not in this for the money because I'm doing it one day a week for free
Right.
and spending my own money to go volunteer around the world. I don't have to. I don't even argue with the client. I don't. I just it literally water off my back. I could care less. But what a great shield against someone hurting your feelings when you truly know you're doing this for the right reason.
Right. I love that.
Yeah.
So, if you don't mind, tell people where they can hear more about you or find out more or see your videos or your podcast, all those things. Tell us where to find you.
Yeah, there's a lot of different places. Although I haven't posted on YouTube for a while, there are some great videos on there, and it's just youtube.com/drcliff. So Dr. Cliff. My website's drcliff.com, or .ca. Instagram at drcliff worldwide vet, and the podcast is Vet Life with Dr. Cliff. And for those that are in Canada, if you check out the TVO YouTube page, you literally just Google it, like Television Ontario, the TVO YouTube page. They purchased a 1 hour documentary that we did about my trip to India recently. This award-winning film festival documentary. You'll have to do some searches because it's a little bit down there on the list now. Or find me on any of those platforms and I can send you a link. It's a fun. I was very, very proud of it. It was I almost got hit with a missile when I was in Ukraine, and so when I came back, I was like, I'm going to take out a second mortgage on my house and just do this film. You
The
only live
film, yeah,
once. Live it, yeah,
exactly.
live life, enjoy it. And I became a film producer and hired a really good director who was a buddy of mine, and went to India and my daughter and I and made this amazing film. So very, very proud
Well,
of it.
maybe after we get off this podcast, you can send me all the links and I'll put them in the show notes so
I
people can
promise.
find
Yeah, yeah,
all of
absolutely. I
your good
appreciate that.
work and learn more about you because it's been really fascinating talking to you and I want to hear more stories. So if you ever want to come back, we'll have another whole podcast of all your stories and how you almost got hit by a missile.
That's right.
I
Well,
think I
I
need to hear
have
that one.
a couple of months ago, I signed with a publisher
Oh,
because I've been
yay.
writing, I've been journaling. All these trips, I've been journaling,
Cool.
and we wrote a book. I wrote a book called Far and Wild: Adventures of a Worldwide Vet, and it's
Okay.
a memoir. And it starts in Jamaica and it ends in Ukraine with this missile warning or missile landing near me. And it'll be published digital, print, the whole bit, audio in 1 year. So I definitely
Nice.
like to come back and
Okay.
talk about that.
Yeah, absolutely. When it gets close, reach out and let me know, and we'll have you back on because I'd definitely like to hear about that.
It's going to be a great book. I'm really excited.
Yeah. Well, it's been super nice meeting you and really fun chatting, and I could go on for hours. And so hopefully you'll come back and we'll talk again.
Yeah, happy to anytime. We could do it before the book comes out, whenever you want. Just reach out to
Okay,
me.
perfect. All right, everybody. This is Dr. Cliff Redford, and I really appreciate you being here. I'm humbled and honored.
My pleasure. Thank you for having me.
All right, have a beautiful week, everyone. Bye.